The month of April is Autism Awareness Month, the specific day being 2nd of April. A developmental disorder that can cause significant social, communication and behavioral changes. Autism spectrum disorder, known to many as just autism, is a subject of discussion today on Health Nuggets. Thank you for tuning in. My name is Aida Munzatsi, and of course, Health Nuggets starts now. Now, Dr. Genwomboy is a mother and a caregiver to 2 children on the autism spectrum disorder. She shares her journey taking care of her 2 daughters.
They all had pretty good years. When the second one was about 2 years, we noticed that she's more isolated. She doesn't want company. And since then, we were seeing our pediatrician. We're still in that stage where you see pediatricians. We were told to take her to school. So we took her to school. And we realized that's the biggest mistake we did because she became more isolated. She regressed further. We actually had to put her back on diapers. And at that time, I was having our third born. Our third born was a couple of months old. So, you know, when a professional tells you there's nothing to worry, she'll catch up, kids grow at different rates and all that. But my mother's instinct kept telling me something is not right. Something is not adding up. When she was, no, that time she was 2. When she was 3, a friend came visiting and hung out with us. And she told me, your daughter has the same characteristics as my friend's child, and my friend's child is autistic. I know what autism is. I mean, in my profession, I knew what that was. But I had not seen the flags. They were right in front of me, but I had not associated them. So at that point, I started looking for options. And every time I would try to find a specialist because I knew this is the area of a neurodevelopmental pediatrician or a developmental pediatrician. I kept on being referred to psychiatrists. And my knowledge of psychiatrists, I said, no, I'm not going to see a psychiatrist. So when she was, the eldest was 4 years, she got sick. She got something called enteritis. So we were admitted in hospital. The pediatrician was very clear. All the flags for autism and other comorbidities were present. And he told me, let's work with what the country provides, which is a psychiatrist. And he referred us to one in KNH. We booked her as a private consult. But when we went, she chose to have us as a public consult so that she could bring in her master's students to give their opinions. And since I didn't have a nanny back then, I went with both my children, because the other one was in school, and my spouse. So we had this, I think this session lasted for 3 or 4 hours because each student had to clerk, see what they think, and come up with a conclusion. So I kept on hearing autism, ADHD, learning disability not defined. So at the end of all this, she summarized and explained to me, yeah, you're on the autism spectrum. That's a much I can do for you from this point. What you need to do is get a neurologist on board so you can design therapies. Then I was like, okay. I mean, I've known for more than 2 years and 7 months this is coming. I just needed to know exactly what am I dealing with. Because you see, I could have said it's autism, then it turns out to be something else. Then when I was about to leave, she said, Mama, sit down. We need to talk about the baby. I'd seen the flags. But you know, as usual as a mother, you want to pray for the best and, you know, ostrich. So we sat, she explained, and she told me that now who is our third born, her autism was going to hit us harder. And because it was more, you know, autism is a spectrum. Her spectrum clicks were towards the worst extreme. So I got to hear things again as autism, and I think we're being given DSM-3 on the scale, which is basically she needs support on everything. I got told about OCD, that is order compulsive disorder, which I see even today. Then we were told she has a learning disability and cognitive retardation. The cognitive retardation is under review now again by a neurodevelopmental pediatrician because a child who has been diagnosed with cognitive retardation cannot do half the things she does. We've come to realize she's very intelligent, only she does things at her pace and her time. She won't do them when you want her to, but she'll do them when she's ready. So that began my journey with the medical end of this. You know, when you're just finding out things, there's a lot being thrown at you. If you're in a hurry to find a fix, trust me, you'll be conned. If you're not in a hurry to get a fix, you do your research, you talk to other parents, who've been ahead of this journey from you. You get different opinions, and you also look at your child, first and foremost, as a child. You know, at 2 years, there are those things every child does. They'll play with mud, they will mess themselves. And then you look at what is autism, what is basically. So I did a lot of research, and I mean, coming from an academia background, I was able to do that very well. So we sat down with my spouse and we agreed on the way forward. The first thing we thought about doing was to get therapists on board. After getting that diagnosis, I still struggle with some things. And the hardest has been that sometimes I want to do what worked with the first one. I think it would work with it doesn't. It doesn't. Reason being, they're on different levels and cycles of the spectrum. One is a sensory seeker. She wants noise. She wants to be hyper. You've experienced her for yourself. The other one doesn't care. She wants to be isolated. She wants to stay in her own small bubble. She hates noise. We've had medical issues with her when she puts things in her ears. Yeah, and then we have to flush them out and then take antibiotics over time. And then we have, when you get noise deletes, sometimes she doesn't like that one, she likes this one. So she has her unique issues. So what works with the first never works with the second one.
From your story, I read acceptance. Probably you can just talk to parents. You've mentioned at some point probably there was some denial, even being in the medical field. So what's the importance of paying close attention to your child and also seeking treatment early?
You know, they say early intervention helps, yeah? But I'd like to look at it as early support. Because intervention is that one thing you do, and you know, it's like sealing a pothole. With autism, there's no pothole to seal, yeah? It's encouraging, you know, it's like a piece of art, making it better. So what I'll talk about is seeking early support systems. Every parent, when you get your child in your hands, you have this beautiful child and you have all these dreams you have, yeah? The biggest issue about autism is this: it is not diagnosed at birth. This is something that starts from 1.8, 1.5 years to 2 years. That's when, because your child can actually have started talking, crawling, and doing everything right, and then all of a sudden everything disappears and the milestones are no longer achieved. So to a parent who's just given birth to a child, I pray that everything is right for your child, that everything goes well. But it's always good to follow up on your clinics. Watch that instinct. And when you hear people say, how come your child hasn't spoken? Don't get angry. Note that down as a flag. How come your child is not walking? Other children walk at this age. Yes, children have a range when they should walk, but if yours goes outside that boundary, don't just sit there. See a developmental pediatrician, see a pediatrician.
Indeed, it is important to understand and pay close attention to your child's behavior, especially in the younger age. Now, Karen Marioki is an autism advocate. I had a small chat with her via Zoom just to understand her journey with autism and how she has managed to be the woman she is today.
The journey as an autistic person, I would say mixed emotions as a result of being misunderstood and being stigmatized. It's a combination of that. So it's just being misunderstood by society and also facing stigma. People just not thinking that you're a spoiled person, you need to be disciplined, you know, this kind of misconception, attitude that society has towards you. Like when you see somebody who is acting out and they don't understand, then they take it like, okay, this child is badly behaved, they need to be beaten, you know, things like this. It has been like that towards my life. And then in some instances, you're being called names like Zimu, you know, you hear such phrases like that, such stigmatizing phrases going through it. So, and then when I was in school, my academia wasn't that great. And then, of course, I faced a lot of discrimination. I was also bullied as well because of my difference, because I was different. So yeah, it was a combination of everything that I went through as I was growing up. And even towards my adult years, still there was that kind of misunderstanding about my disability. I didn't discover that I was autistic until around 21. So I decided, that this was the right time for me to just come out and just say what I have to say. So yeah. So with that therapy, it has helped me to not only express myself, but also to advocate for myself and other autistic people out there. And let's not treat autism as a behavioral problem. It's not. It's not a behavioral issue. It has never been. We're not people that have this kind of thing. I would say behavior is communication, and that has been said by actually autistic people. Know what they like. You have to look at what they like, what they don't like, and some of the things that have been commenting, it's about their sensory environment, sensory seeking environment, their environment that's either if it's comfortable with their environment, whether they're comfortable or not comfortable with their environment. And that's some of the things that you should look at, and also listen to what, like, if it's something that is off for them, just change the routine. It has something also to do with the routine. The routine is so important because I think that can really impact them very much. So I'd say to caregivers, not autism as something that needs to be celebrated. It's part of an autistic child's world. It's part of who they are, and as an autistic individual, I would say autism is part of who I am, and nothing can take that away. If you take that very part, you're pretty much saying that I want you fixed. So let's look at autism in a very positive way, and let's not look at it as something that needs to be done away with.
So find that what works for your child. Yeah. In this house, we've accepted that our water bill will always be high because water is a sensory thing for our children and they like hanging out in water. If I could afford it, I'd build a swimming pool and I'll be very happy because they'll be permanently in water. But I can't afford it, so I find other ways. So find that works for your child. For me, that is a style of parenting that works for me.
So we have a slight understanding of autism, but let's understand this condition further with the help of Dr. Florence Oring, who is a developmental pediatrician. Dr. Thank you for joining us on Health Nuggets, and it's a pleasure to have you on show tonight.
Thank you so much, Ida. I'm glad to be on the show. Yes.
Thank you. So let's just start with the basis. What exactly is autism?
Okay, so autism is a developmental disorder. And by developmental, we mean that it starts when the child's brain is still developing and something happens and brain development ceases at some point or is disrupted. So once the development is disrupted, you have key things that are affected in the child's development. The first is usually the communication in the child. You'll always find a communication deficit in the child. The second is usually the social interactions in the child will be affected. And thirdly, the children tend to start having behaviors and mannerisms that are repetitive in character.
So you've said it's a condition that we'll say mostly affects children. So does it happen during birth, after birth, and what are some of the things that might lead to this condition?
It's a condition that starts during the developmental process. So most times children start off normal, so they have normal physical growth, but around age 1.5 years, parents begin to notice that children are beginning to lose certain skills. A few children actually do not attain those skills, but majority of children will attain a few social skills and communication skills, but along the way they start losing some of the words they had learned to speak, or they start having behaviors that parents don't seem to think they are normal for a typical child.
And probably what are some of these behaviors? And when you talk of repetitive behaviors, probably you can just give us examples.
So we always say that there's no single entity that specifically defines autism. The behaviors we see in autism are so diverse. So no two children look alike. But specifically, the common behaviors that we see in these children is what we call stereotypies. So these children repeatedly do certain activities over and over. Some of the activities may be vocal, so they may keep repeating some words. Sometimes they're watching cartoon series and they keep repeating what the cartoon is saying, or when they're given an instruction they keep repeating what the instruction is before they go on and do that what the instruction is asking them to do. So that's a vocal stereotypy. And then the other behaviors that we see is just pacing around, rocking their heads, head banging. They sometimes hit their own heads. Sometimes they may pace back and forth without, purposeless, without really, knowing that they're actually being a nuisance to the people who are around them. So those are the commonest that we see. Yeah, but a few of them also may develop some disruptive behaviors. So they may begin to do things like self-biting, which can be quite disruptive to the family. Yeah.
What of probably stares and paying attention to the child?
Yeah, so as I said earlier, so for us to make a diagnosis of autism, we have to have a criteria fulfilled. So we use like a sort of a checklist. So we tick off the things that the child is manifesting with. And so the criteria must manifest with those repetitive behaviors that I've talked about. And then there has to be some social deficits in interaction. So we see children who do not interact socially in the manner that we would expect them to do. So they may not, you may call their name and they do not respond to their own name, or they may avoid looking at your face, so they avoid eye contact, or sometimes they may just avoid people and they want to play on their own. They actually prefer to play on their own most of the time. So you'll find that is one of some of the social characteristics that we see that tell us that this child, there's a red flag for autism. And when it comes to their communication deficits, it's a whole range of things that we see. Some children with autism may actually be able to communicate. They may be verbal. But for majority of the ones that we're seeing in our setup, they are non-verbal. So they have limited verbal communication. And what does that mean? So it means that the child may have no words at all that they are able to use. Or if they're using some words, it may be just jargon. So it's not words that you can understand. Yeah. Or some of them have short phrases that they only produce them at their convenience, and they're not repetitive. They cannot be repeated. When you ask them to repeat that phrase, it may not be repeated at a different setting. And then there's that category who are actually verbal, they are talking, but we still pick some unusual characteristics in their speech. So you'll see like they keep repeating themselves in what they're saying. We also see that they may focus on certain topics, like you ask them how their day was and they're talking about cars that they were driving during the day. They're talking about animals. So they totally lose focus on what they are discussing with you. So they have a certain fixture on things that they have preference on. Yeah.
Okay, so as an expert, probably you'll say those are some of the red flags that parents should look out for. Let us look at the risk factors. Of course, you've already talked over the diagnosis. Let us look at risk factors.
So again, this is one condition that is so poorly understood. So a lot of information is still missing. But generally we know that autism is predominantly a genetic condition. So most of these children, there's an underlying genetic condition. It's not one gene that causes autism. There are multiple genes that have been associated with autism, but there's none that contributes wholly to the whole spectrum of autism. But whenever we see families with autism, we always look at other children within the family, because there's a high tendency that if one child in that family has, there's a much higher tendency that another child may have some other child on the spectrum or with other deficits in communication. Yeah.
And what are the chances of me as a parent, probably I have autism, what are the chances of me giving birth to a child with autism?
So the inheritance of autism is not one-to-one. So it's not like every parent who has autism will transmit it to their child. Because most of these genetic defects that we see are mutations, or what we call variations. So you may find that the child has that variation, which is slightly different from what the parent has. So they may never be exactly the same. So the chance is usually small. We say that if like a sibling has autism, there's 1 in 20 chance that another sibling will have autism. Yes.
And you've said it's a condition that is not understood by many. Are there numbers in Kenya for people that have autism?
Again, that's a big gap that we still face because we don't have too much research going on in our settings. So we rely a lot on information that we get from other countries, especially the developed nations. But the few research that are coming up currently, it's clearly showing that the prevalence of autism is no different in our setting as it is in the developed countries. So we are talking about a prevalence of about 1 in 60 children have autism. Every 1 in 60 children have autism. Yes.
So does that affect treatment, and what are some of the treatment considerations that are there, and does autism has cure?
Okay, that's an interesting question I get from so many parents. Parents are always looking out for a cure. But when we are handling these children, we don't promise a cure to autism because autism is genetic predominantly. A few cases may be environmental, but majority are genetic. And you cannot change a child's genetics. So it's a condition a child will acquire as they're going along in their developmental phase. But what we aim at when we are treating these children is to improve functioning. So can their communication skills improve? Can their social skills improve? Can adaptive skills that they are having improve? And can the academic functioning improve? So the aim of interventions is to improve functioning, not to cure the autism.
Yes. So there is no cure.
We can say that, but you can improve to the point that you will become independent.
So let us look at some quick facts of autism. Yeah.
So basically, autism children present with deficits in social interactions, deficits in communication, and then repetitive, restrictive behaviors. Those are the key symptoms of autism.
Probably you could be having an advice to parents and your parting shot.
Okay. So 3 important advices to parents. Number 1 is that they are the biggest advocate for their own children. It's a condition that people do not understand. And so the parents need to stand out and speak for those children because these children cannot speak for themselves. So when you go to a doctor's office or you're in the public situation, be the one speaking out for that child and lobbying for their rights, even with the government entities. Number 2 is that raising a child with autism is a lot of work. I mean, a typical child is enough work, but raising a child with autism is a lot of work. And parents always require support. So my advice to parents is that you need to seek out for support when you need it. Get into parent support groups that will, mentor you and help you cope with some of those circumstances that you find difficult. And then if you need your own psychosocial support, you need a counselor to talk to, you need a friend to talk to, please look out for that friend to talk to. The last and final advice, please do not go into interventions that are not proven because some of them can be harmful to children. A lot of parents are so desperate for a solution that they are always coerced into giving children interventions that are still not yet proven to be effective. So parents should seek medical advice from clinicians who understand this condition and not just start their own interventions which they think would help the child because there's no cure to autism.
We We proceed in finding solutions as far as autism is concerned. Well, there's no known cure for autism. However, therapies and other treatment considerations can help and enable autistic persons thrive. To proceed, I'm being joined by Perpetua Omondi, who is a pediatric occupational therapist. Perpetua, thank you so much for joining us on Health Nuggets.
Thank you for the invite.
I believe therapy is one of the solutions for autism. Let us look at some of the therapies and some of the solutions to autism.
Yes, so we can say it's just treatment. The treatments they can be able to access, and they access treatment from a multidisciplinary team, meaning from different people. So as you well said, occupational therapists are one of the people in the multidisciplinary team. We have speech and language therapists. We have physiotherapists to work with their coordination, and then we have ABA specialists, that is applied behavior analysts, who are able to work with their behavioral challenges. And then we also have relationship development intervention. So these ones come in to help with the relationship, the development of the relationship.
For occupational therapists, what exactly is done? What are some of the activities done?
Okay, good. So just first with describing what occupational therapy is, so someone might be able to get where we go even with the activity. So occupational therapy is a client-centered profession where we focus on enabling the clients to be able to do what they need to do, required to do, or expected to do through meaningful activities. And if we say and look at the children with autism, that means to be able to help them to access school, to be able to do their handwriting in school. And then one other thing we actually do a lot of intervention is sensory integration, because you'll find that most of them have sensory integration challenges, where you find that there are those who cover their ears because they feel like the noise is too loud. Then there are those who seek movement. Someone might say they're hyperactive, but they seek movement. So we give them things like a weighted blanket or a weighted jacket to help them to give those that feedback. And there are those, they really like touching things. They want to touch your hair, touch your face, touch everywhere. So you'll find that now we give them the tactile desensitization through the brushing protocol and things like that. So that's where the occupational therapists come in.
So you've talked of weighted blankets and brushing protocols. Probably you can just let our viewers know how each and every one of those works.
So as I said, there are various ways now the occupational therapist intervenes. So these ones are just majorly now focusing on the sensory integration. So if it's with the weighted jacket or the weighted blanket, now these are things that will give the child the proprioceptive feedback, which they actually seek for. The feedback to the joints and to the muscles. So when they have the jacket or the blanket, now the need for movement is reduced because they're now getting that feedback without moving at all with the jacket. So that's where the weighted jacket blanket comes in, and the weighted jacket. And then with the brushing protocol, now that works on the tactile, where you are enabling them to have the feel of that feeling of the touch. So that's where the brushing protocol now comes in. So you'll find that under occupational therapy, people will do many things. So that's just one. So the other areas we train activities of daily living, meaning we train them on how to feed independently, how to toilet train, because that's one area that parents also say it's quite a challenge. So how to toilet train, how to dress themselves, that is one other area we focus on. How to take care of themselves, grooming, that is brushing, combing their hair, and things like that. And then also now we bring structure into their day, where we create routines and visual schedules. Because a child or a person with autism requires structure, and the structure gives them a source of calmness. It gives them a source of, they're able to focus. So we create the visual schedules, we create the structures, and guide the families and even the individuals on how to go throughout the day. Yeah.
Now, the fact remains that autism has no cure, and this brings the need to a strong support system that autistic person and their caregivers need. I don't know what your takeaway home is as far as autism is concerned, but to parents, caregivers, and autistic persons, seek advice from medical practitioners that understand the condition better. Do not just start an intervention without an expert's opinion on the same. We have also heard what the red flags and the signs are. So to parents, pay close attention to your child's behavior, especially in the younger age. Do not assume anything. That marks the end of Health Nuggets tonight. I've been your host, Ida Munzatsi. Until next Monday, your health